Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and I want you to be able to stay in touch with me and keep educated and empowered throughout pregnancy, birth, and parenting. So please follow me on Instagram and Facebook at Brayton Birth Method. And today's guest is Julie Tupler, and we'll be speaking on healing diastasis recti, a topic that is very near and dear to my heart as a chiropractor. Julie Tupler is a registered nurse, certified childbirth educator, and certified personal trainer. She developed the Maternal Fitness Program in 1990 and for over 30 years has been teaching and developing the Tupler Technique Program for women during and after pregnancy. In 2009, she opened Diastasis Rehab to specialize in the treatment of diastasis recti for women, men, and children. Dr. Oz calls Julie an expert on diastasis recti, and Elle Macpherson credits the Tupler technique for a 20-minute delivery in her fast recovery. The Tupler technique, a research and evidence-based program to treat diastasis recti, has now been translated into 6 different languages. Julie trains medical and fitness professionals all over the world in her proprietary program, and Julie has written 3 bestselling books, Maternal Fitness, Lose Your Mummy Tummy, and her recent book, TogetherTape. She has produced 5 videos on diastasis and invented the Diastasis Rehab Splint, Diastometer for measuring a diastasis, Corrective connective tissue cream, and TogetherTape. Julie has developed an 18-week ongoing online support program for her clients all over the world, and she's on the advisory board of Fit Pregnancy, Women's Health Foundation, and the Women's Sports Foundation and Medical Fitness Network. She's a frequent speaker at medical and fitness conferences, including the American Hernia Society, where in 2015, she spoke on the non-surgical Tupler technique approach to diastasis recti at the first World Conference before abdominal surgery to prevent incisional hernia at the Hernia Conference in Hamburg, Germany in 2019. Her website is diastasisrehab.com. Hi, Julie. Welcome to the show. I'm so excited to have you on today.
And I am excited, Laura. I'm so excited that you asked me to do this because I am always wanting to talk about diastasis recti, which is something that most people have and just don't know it.
Yeah, I'm realizing now, I've been in practice for 17 years as a chiropractor, and I see so many perinatal women, and I'm realizing there is not a lot of awareness out there in the public about this. And obviously it's not even just specific to women or pregnant women, postpartum women. This is universal. It can impact children and men as well. And I'm just finding that a lot of doctors don't know to look for it and diagnose it, and therefore recommend, the appropriate treatment for it.
Right. Well, my goal by being on your show and speaking at different, conferences is that every belly should be checked for a diastasis as part of any either medical evaluation or fitness evaluation, that they should be checked. Because the side effects, when you think about it, what is the job of your outermost abdominal muscles? Their job is to support your back and support your organs. So when they separate and the connective tissue joining these muscles stretches sideways and then gets thinner as it stretches sideways, it is now that weak connective tissue doing the muscle's job. And they don't do a very good job because the connective tissue is thin. So the organs move forward and you get that bulging belly. You get back pain. You get, after you eat, you get usually bloating after you're eating. You get constipation because the organs are moving. You get pelvic floor issues. All right. You get umbilical hernia. You get poor posture. I mean, it's just like amazing to me that this has been so ignored and considered cosmetic when it's actually functional, because the only way you can have a strong core is if the muscles are close together. End of story.
That's right. It makes perfect sense to me. And I do know when people have weak cores in my office, they do not hold their adjustments and they have a lot of back and joint pain because of this muscular weakness. So this really, to me, is like eye-opening that this is something that we can really do a better job at identifying and treating. So I'd love for you to start off with sharing a little bit about how you got into this as your passion, and you know, like what's your start to this?
Well, my start to this is that I am a registered nurse. I'm a certified personal trainer and childbirth educator. So when I moved to New York in '87, I started teaching exercise at this health club, and they said to me, "You're a nurse. You should teach the prenatal class." And I went, "Wow, that sounds great to me." And I'd always wanted to work in labor until so, but there was nobody. I mean, the American College of Obstetricians and Gynecologists had barely written their guidelines. So there wasn't hardly anybody. So there wasn't really anybody for me to learn from. There was one physical therapist that I took her class, Elizabeth Noble. But I sort of I didn't agree with everything that she said. All right. So I thought, I'm going to have to create my own program. So what happened was, when the people in the class found out that I was a nurse, they started picking my brain about labor. So then I became a childbirth educator and realized that childbirth education comes at the end of the pregnancy and only prepares your mind. Now, you wouldn't run in a race and not train. Why would a woman do the hardest thing she is going to do and not have that mind and body connection? And having strong abdominals and knowing how to push with your abdominals and relax the pelvic floor, all right, is the most important thing a pregnant woman can learn, because you can save yourself from hemorrhoids, prolapse of your organs, urinary incontinence. All that could be avoided. And all you have to do is practice pushing every time you go to the bathroom. Abdominals, back, pelvic. So we'd learn how to isolate and separate the muscles. Also, a large diastasis puts a pregnant woman at risk for a C-section. So when the muscles separate, what happens is the top of the uterus tilts forward. So now, if the top is tilting forward, you can imagine where the cervix is going to be. It's going to be facing sideways instead of downwards. So, that cervix has to be pointing downwards, lined up with the vaginal canal, so that the baby has a straight shot of coming out.
Right.
So it's really important for women to understand this. And I just trained in my last professional training, I trained a woman professional, and she was in her second trimester. She had a 6-finger diastasis. And in 3 weeks of doing my program, as her belly is getting bigger during her pregnancy, she brought it down to 3 fingers and maintained it the rest of her pregnancy. And pushing was a breeze, because she knew how to push with her abdomen, because she practiced it, right? Every time she went to the bathroom and had a bowel movement, she practiced that, because it's sort of like the same concept there. And she, had and didn't have any, and she was up and about right away because she didn't have any of the side effects. So I knew that pushing was something that the childbirth educators didn't teach. All right. So that's why
proper pushing,
right. They'll do the huffing and the puffing, but that doesn't really, do too much in terms of, and you see sometimes in the hospital, you see the nurses pressing down, trying to push on the uterus, and if a person has the innermost abdominal muscle, which is the transverse muscle, if they have that transverse muscle strength and awareness of, if it's strong and they know how to use it because they've practiced it during the pregnancy, then it's going to be second nature when they get to the birth. So that's how I started. So I was Maternal Fitness, and I started my own business in 1990, and then wrote a book called Maternal Fitness in 1996. And then I saw this doming of the abdominals, and I thought, what is that? And there was like nothing out there on this other than this is a diastasis. So Are you
referring to postpartum or?
No, during the pregnancy.
Wow.
And postpartum, because I treated, I worked with pre and post. So one physical therapist that did she said, I can't feel my muscles I just can't feel them. I can't feel them. All right. So I said, all right, let's bring them together where they're supposed to be. And so I took a scarf and I had her pull the scarf and now I can feel them. So that was the start. That was one of my light bulb moments that I realized, because, you have to bring them together for the muscles to work in the direction they're supposed to work, in a front to back direction. Okay, so basically that's how I got started with that, and the diastasis, because nobody was checking for it, there was no information about it. I sort of like started on like, now, okay, let's see what I can do, and then another physical therapist that was teaching my class, she and we would teach the class over 6 weeks. We would check the diastasis in week 1 and week 6. And what we were finding is that, as I told you with the professional I trained, that the diastasis was getting smaller over 6 weeks as they were getting more pregnant. All right. So the muscles during pregnancy can stretch without separating. All right. They don't.
And I think that's going to give a lot of hope to women listening. I think sometimes they think, oh, I can't do anything until after the birth. Right. But you're actually saying there's a lot you can do while you're pregnant to correct it.
Absolutely. You can maintain that and really have your abdominals be, for a pregnant woman, having her abdominals be the strongest part of her body will make her recovery better, will make her labor better, make her pregnancy better.
Definitely
it's like a win-win situation. And that's like so important. So, so what we found, so this physical therapist says, well, you need to get research. So I contacted Columbia University Program in Physical Therapy, and my researchers were there, and it had 2 groups. And of course, the group that did my program had a smaller diastasis. So, and then my statistics show that my program can make a diastasis 55% smaller in 6 weeks. And those statistics are up on my website. They go into detail, a lot more detail. But that's the big picture, of what it is. So it's just been and then 2009, I closed my studio down because there were so many people saying, well, I have a diastasis too, or I've never, so and Maternal Fitness, that name just didn't fit what I was doing. So and by 2009, more people were doing prenatal. So I wanted to do something that people weren't doing. So in 2009, I became Diastasis Rehab and expanded my the people that my target audience to women that whether they've been pregnant or not pregnant, men and children, and also working with people before abdominal surgery. That's my ab rehab video because. And I just got back from speaking at the hernia conference in Hamburg, and basically what I was speaking about was making a diastasis smaller before abdominal surgery to prevent an incisional hernia. And basically what I'm saying is to prevent the stitches from coming undone. So when you have surgery and the stitches come undone, that's called an incisional hernia. And with abdominals, you use your abdominals with every move you make and with every breath you take. And people prepare for shoulder surgery and knee surgery, but nobody prepares for abdominal surgery. And doctors say after abdominal surgery, don't lift anything over 5 pounds. So if I stand up, I'm lifting 135 pounds. So we need to teach the people. So by doing my program before the abdominal surgery, whether any kind of abdominal surgery, if somebody says, oh, I want to have a tummy tuck, they need to do my program. And I have several plastic surgeons that refer them to my program. They need to do it because, number one, it strengthens the connective tissue. And when you strengthen the connective tissue and then you sew it, it's going to hold the stitches better. And also, we teach then the people how to use their abdominals in the recovery process. All right. So once they have this transverse muscle strength and awareness, when they stand up, they're engaging. So it doesn't push on the stitches. When they sneeze, when they cough, when they go to the bathroom, whatever it is, they know they have the strength and the awareness to know how to use their abdominals in the recovery process to maintain the integrity of those sutures. So that's basically how I got to where I am now. And, I just came out with another book called Together Tummy because I updated it. And I have 5 videos: the Lose Your Mummy Tummy, the Say Goodbye to Your Gut Guy, the Perfect Pushing, Ab Rehab for before abdominal surgery, and Belly Button Boogie for children. And then we also have that was my hardest video, trust me.
Love the name.
Yeah, it was with all those children. Oh my God, that was a challenge. But it's the kids love it, and it's really important to get the kids. And usually, kids can get started doing the exercises, and sometimes the mothers and the children do it together. They wear the splints and they do the exercises together, which is really fun, and helpful for both of them. But I also, as I mentioned to you earlier, when we were talking, that I do have also an ongoing online support program, right? So that once they're, signed up, there's no expiration date on it at all. So they can.
Right. There's a lot of support.
There's a lot of this program works with, with support.
Right.
So I give, there's weekly videos, there's weekly tips, a blog to reach out to others, and then I do a monthly webinar to answer questions. So yeah. Do you have any other questions for
Julie?
me?
Yeah, I'd love for you to share a little. I think it's more common knowledge about how you could have an abdominal separation from pregnancy and birth, but I don't think a lot of people are aware of how this impacts children and men. So I would love for you to kind of talk about that population regarding this condition.
Okay. So everybody's born with a diastasis, with their muscles separated. And usually at about 3 years old, after the nervous system develops, the muscles usually come together. Now, I don't say close, because you have a weak spot in the connective tissue, right at the umbilicus. And if you put any kind of force or pressure on it, for example, if the baby cries a lot, it's going to be forcing it out. If the baby's constipated and continuously do that forward movement. So there's a lot of things also in childhood. Doing gymnastics, where you're arching your back, which flares the ribs and stretches the connective tissue sideways. A lot of swimming, a lot of dancing, where you're arching your back. So these things open it up. All right. So, so that's the issue. Why? And then it only gets worse as you age. And then, of course, crunches can create a diastasis, or if you have one before you started doing the crunches, it certainly makes it worse.
You don't recommend crunches for anyone?
Never.
Really?
Never.
I did crunches this morning.
Never. It's the worst thing that you can do for your back and for your abdominal muscles.
All right. I thought it was just contraindicated for somebody with a diastasis.
No, it's contraindicated for everybody. I do what's called head lifts, because what happens is when you bring the shoulders off the floor, it's physically impossible to engage transverse. And if you can't engage it, which direction is it going? It's going forward, so you're building the muscles in the wrong direction. You're lengthening them that's why people get those moon-shaped abdominals. And you're putting force on that weak spot in the connective tissue, and you're stretching it forwards. And we don't want to stretch it forwards or sideways. The whole point of my program is healing the connective tissue, and part of that healing process is not stretching it either forwards or sideways. So crunches is like the worst you can do. The worst. The worst.
Well, I'm glad I learned something today.
Yeah, the worst. We never want you to do crunches.
Got it. So with the kids that you see in your practice, they're going to be over the age of 3.
Well,
it sounds like.
Well, it's if they're, because we get a lot of children, and all we can do until they develop that awareness of bringing their belly button to their spine, until they can, think about, okay, belly button to the spine, and look at it and connect it and do that. All right. Then they can't do the exercises. So usually it's at about, I did a class with my daughter, and they were about 6 years old, and they were able to do it. So 6 years old is that sometimes at 5 years old, the 5-year-olds can do it too. They can imitate it and get started with doing that. But that's with the children. And then we of course splint them too.
Right. And then with men, I mean, I could see why, like, lifting a lot of heavy objects or having a beer belly, how that could create stress on their abdominal wall.
All of that. Car accidents, doing improper exercise, bigger belly. And the other thing about men, now, some people, Laura, stop and smell the roses. I stop and look at the pigeons, okay? And you can always tell a female pigeon from a male pigeon. And how do I know the difference? Is because the male pigeons puff out their chest. Now, men are told to stick out their chest. And when they stick out their chest, what do? They flare their ribs. Women are told to hold their bellies in. Men are told to stick out their chest. Okay? And it's a very interesting concept. Like, women are told to have surgery for it, and men are told to just live with it when they discover. And they go from test to test to test to test to test because they know something's not right there. All right? And nobody has checked them, and then by accident they find out sometimes that they have a diastasis, just by accident, or somebody might know of it. But you hear these people, they go from, I've had a scan and an MRI, and I've been to this doctor and that doctor and this doctor and that doctor and this one and that one, and they think I'm okay. They don't know what it is. They want to give me medication. They think it's in my head, So it's a sad state of affairs, with this. So that's why I'm thrilled to be on this show and talk about this, because it can be treated in the way, and for the big picture, it's all about healing this connective tissue, which is called the linea alba, that's in between those two outermost recti muscles. So when we use the term diastasis recti, it's a separation of the recti muscle. So the whole point is to heal that connective tissue. And you heal the connective tissue by approximating it. So we put it into a narrow position. So it's sort of like the concept of a cast. When you cast a broken bone, what does it do? It immobilizes it. And what you're wanting to do is keep those two ends of the bone close together so they eventually do what? Fuse, right? And that's basically what you're doing with the splint. So you're doing two things with the splint, this Diastasis Rehab Splint. We're bringing the connective tissue closer together, and we're continuously keeping it in that position so the body knows that that's the position we want it to heal in. And we're bringing the muscles close together, because if the muscles are 4 fingers apart or more, if you look at under ultrasound, they move sideways. So a sideways movement does not strengthen the muscle, but also it stretches the connective tissue as it moves sideways, because the transverse inserts into the back. So that the wider it is, it moves sideways. So we have to bring the muscles together so they move in the right direction, front to back, and keep the connective tissue in the narrow position. Second thing we have to do is prevent the connective tissue from getting stretched forwards or sideways. So we want to make sure that we're not doing exercises in a downward facing abdominal position where all the weight of the organs like stretches the connective tissue. So we don't want to do that. If we're going to do planks and push-ups, we do them standing against a wall. And I don't even start my exercise program with clients until week 6. Once they have developed this innermost abdominal muscle, transverse muscle strength and awareness, then we incorporate it into a diastasis safe exercise routine. So with every repetition, they're able to use their abdominal muscles, okay? With every repetition. And you have to be strong enough to be able to do that. So you're thinking about all the power coming from the abdominals as you lift the arms, all the power coming from the abdominals when you do a squat. The squat is straightening you up. Everything is coming from your core. And so first 6 weeks, just cardio, like walking outside, walking on a treadmill, elliptical machine, upright stationary bike. And then developing the transverse muscle awareness with activities of daily living, going to the bathroom, standing up, sitting down, picking up their child, etc.
Child care is a big one, right?
And then that's a big one. And then the third thing is strengthening. So I have these little isometric exercises that they do seated, and they can do them when they're driving in the car. They can do them when they're feeding their baby. It's a great time to do these little exercises. And initially, I was wondering why it healed the connective tissue. I mean, it's a combination of the positioning and then doing the exercises, but the research from Dr. Helene Langevin, a neurologist out of Vermont, she talks about healing connective tissue and these backward movements, this backward compression that I do once, of course, the connective tissue and the muscles are in the right position. But these little contracting, these isometric contractions that I do to strengthen the transverse muscle, that creates a microcurrent in the connective tissue. And that microcurrent is what remodels and heals it. So, I was like, oh, okay. Because I'm thinking, why? Because when we check for a diastasis, we check not only the distance between the two separated muscles in 3 places, halfway between the bottom of the sternum and the belly button on top, and halfway between the belly button and the pubic bone on the bottom, and of course at the belly button. And we also measure the condition of the connective tissue. How deep can my fingers go? Sometimes, these people have such a severe diastasis, I can almost touch their spine and I can feel all their organs moving. Okay, so, so that's what we check when we're, checking for the diastasis. And my goal is to make the connective tissue strong enough to be able to hold those muscles in a close together position. And because you have that weak spot in your connective tissue, at some point you can stop wearing the splint when the connective tissue is strong enough, but you have to continue doing the exercises. And that's why my program is ongoing. If you need a refresher on, and come and ask some questions about a workout that you're doing or something like that. So it's, and because you have that weak spot, you're always at risk for opening it up. Like I could create a diastasis on myself if I started, doing crunches. I could open my muscles back up because I have that weak spot in the connective tissue at my belly button. So,
yeah, but you don't want to do that.
No, I don't want to do that. So these exercises. So when I walk to my office, which is about maybe 20 minutes, so I'll walk there and I'll walk through. I go through a nice little park. I do about 500 of my little exercises walking, and then I do 500 back. So I get about 1,000. Or when I go to the gym and I'm walking. So that's you have to maintain that.
Right. So I do, right after I gave birth, I wore a belly splint, for like 4 to 6 weeks. And I definitely felt like it was just to me very intuitive that after having such a stretched abdominal wall from the pregnancy that I would want to support those muscles and knitting back together.
Well, a lot of those binders are for compression and not approximation.
Yeah, I got the one from Belly's Inc., and it was definitely more for approximation of the wall, to help prevent diastasis, the diastasis, or heal it. But I guess some people have concerns about splinting and creating muscle atrophy.
Okay, so here's and that's now if you're wearing a cast, you're going to create muscle atrophy on your arm. But this is not a cast. This is a movable thing, and with my exercises, the sole purpose is to bring the connective tissue. It's just positional. Once you put it in the right position, there's no weakening of the muscles. We're putting them in the right position so that you can strengthen the muscles, and they're going to be stronger than they've ever been. So we start out at doing 5 sets of 100 of these exercises and work up in week 18 to 20 sets of 100. All right, there's no weakening of the muscles here. If you look at the before and after pictures on my website, you see I have one physician, and she had an umbilical hernia, and the program reversed her umbilical hernia. And she said to me, the best thing about this program, she said, and you look at her picture, she says, my abdominals, even before children, never look like this. She says, my husband's buying me lingerie. So that was the best thing. She says he's never bought me lingerie, never. So if you look at the pictures, you see that that it makes a big difference, and the back pain goes away, and your posture is better, and it's just The bloating after eating, you can go back to a normal diet because people get the bloating after eating and thinking, oh, I'm eating the wrong food. And so then they stop eating this, they stop eating that, they stop eating this, and they still have the bloating. And they're scratching their head. Why am I'm not eating anything? What is going on here? What is going on here?
Yeah, I mean, it's impacting the digestive system. That makes a lot of sense. So have you actually, I've never heard of somebody with an umbilical hernia being able to reverse it without surgery.
Yeah, well, the umbilical hernia is a side effect of a diastasis. So if you repair the umbilical hernia and you're open above and below, the chances of maintaining that, the chances of getting an incisional hernia are like great. And that incisional hernia surgery, having an incisional hernia is one of the top surgeries that's done because it just, it comes undone. I mean, it just makes sense that you're open above and below and they have to redo it. And it just doesn't stay. It doesn't stay because you're open above, so you're so in the middle, it doesn't stay.
Have you had any cases that still needed surgery after going through your program?
Well, most of the people, if they're not having pain, if they have an umbilical hernia and they're not having pain, then I recommend they do the program. And most of the people, my trainer in Vienna that I'm training now, she's so excited, that her belly button is changing. And this has just been a couple of weeks. Okay. So she is thrilled. She goes, and we take the pictures so that we can, look at it to see this is where it was and this is where it is now. So the belly button, once you strengthen the connective tissue there, it brings support to the umbilicus. That's what it is. And sewing it doesn't strengthen the connective tissue. You're just sewing it. And just like if I, kept on putting my heel in the hem of my skirt, eventually the stitches would come undone. So it's the same thing. You put force on those stitches, it comes undone.
And it almost seems like with surgery, there would be a weakening of the wall, of the abdominal wall.
Well, it's, there is a weakening because they cut you from hip bone to hip bone. So that's a major surgery. So when they cut you from hip bone to hip bone, you end up with a scar. And when you have a scar, it creates an adhesion. And when you have an adhesion, that means that the layers of connective tissue are stuck together. And anytime you have a stuckness in the tissue, it causes pain. So then you have to do scar mobilization to unstick the stuck together layers of connective tissue. All right. So that's like another thing. And that surgery, that tummy tuck surgery, I'm telling you, it sounds like an outpatient surgery at tummy tuck, but it is one brutal surgery and the recovery is horrific. So I don't recommend it. I recommend doing my program. And then if you have an issue with the skin, there are, laser type of machines now. I mean, they're getting very sophisticated that stimulate the collagen, so I recommend doing that first without having to go through that surgery.
Yeah, that makes a lot of sense to me. So I'm actually also thinking about a friend of mine who is going through a mommy transformation with her kickboxing gym. Uh-huh. And she was showing videos of people who've were on stage in their bathing suits that had, transformed their bodies through kickboxing. And the women that had given birth, almost all of them had what she called the upside down belly button. And it was just kind of like, oh, that's just that was the accepted, well, these women are fit everywhere except their belly button is sagging.
Right. They have a sad belly button.
They have a sad belly button. And I'm just thinking, I don't care. Even if they had twins, even these women, their body went through a lot, multiple pregnancies. But what you're saying is that woman does not have to live with a sad belly button.
No, or the hoodies. We have them with the hoodies, the sad little hoodie belly buttons, right? No, the belly buttons change. The belly buttons change for sure. Once you strengthen that connective tissue, the belly button gets sucked back in.
Yeah, where it belongs.
Mm-hmm, where it belongs, yeah.
Well, I just think that more and more women just really need to know that this is possible. And to what you're saying, that there's a self-esteem and a self-confidence about how your body looks in a bathing suit,
And,
at home with your husband, in your lingerie.
and not only that, on some women, it's dangerous because if your muscles are separated in the connective tissue, if your baby kicks you in your child has a temper tantrum and kicks you in the stomach and tears that connective tissue away from the muscle, then your organs are exposed and you have to have surgery. That's dangerous, right? And, that's right at your core. And if your core is open, you feel so vulnerable and open. It's a psychological thing also.
Your third chakra, that's like your place, your
right.
sense of power.
That's
is
right.
coming
And there's
from
no
there.
power if your muscles are separated. You only have power when the muscles are where they're supposed to be, close together.
Wow. Oh my God. Like, this is just blowing my mind. Like, this is like, there's the physical, there's there's so many components to this, right? There is an aesthetic component, but that is definitely not even the highest priority here. It's like keeping your organs together, keeping your spine straight and lined up, and having your third chakra totally activated so that you can live your purpose.
That's exactly. It makes such a big difference. It just makes such a big difference. Bringing, because the core is right in the middle of your body. So it affects your upper body and it affects your lower body.
Right. It's everything. And like you said, all movement has to come from your core as well. Getting out of bed, walking, standing, all of that is core activated.
Right. Exactly.
So for women that are, or any listener who's wanting to do this program but doesn't live, by your office in Manhattan, how can they work with somebody or do this online to get the support they need?
Okay, well, we do have trainers in different areas, and you can look on the trainers in your area page. But if we don't, you can do the program on your own. Many people do. You can buy the package with the video. You can buy the women's or men's package 1 or women's or men's package 2. The package 2 comes with the book and the cream and the tape, and a Dynaband. And the package 1 is just, basic. But both packages come with a online support program. And it's, as I mentioned earlier, it's an ongoing online support program. So you can do it on your own, at your own pace, or we start classes, at the beginning of each month so that people can start with a group and maybe get a belly buddy to work with. And then I do these monthly, live webinars to answer people's questions. And there's weekly videos, weekly tips. There's a blog to connect with others doing the program and share. And so you can do that. I work with people via Skype also. And the other thing is that if you don't have somebody in your area, I'm always looking for somebody. And as part of the training program, the professionals need 2 case studies. So if they find somebody, they could be one of the case studies and get trained for free. So if you want to bring somebody to your area, it would be probably worth your while.
Right. And to find all this information, they're going to the diastasisrehab.com. Diastasisrehab.com, or Rehab they can do, or julietupler.com, or tuplertechnique.com. Diastasis is sometimes difficult to spell. Right. And that is the Tupler Technique, is what you're speaking to.
Yeah. The Tupler Technique is my research and evidence-based program.
Mm-hmm. Well, I love that this is available for people living. I have listeners that are all over the world. So, even if they're outside of the U.S., they can still get guidance, support, videos, and equipment online.
For those people in Europe, I'm going to be having another a place where I'm going to distribute my products out of Europe, so that they don't have to pay all those tariffs and fees and stuff like that. They can just get them, delivered from Europe,
Right. That's an easier process.
Yeah,
I mean, I feel like in some ways, just speaking, to the pelvic PT in my practice, that Europeans are so much more aware about this type of stuff and
they are.
And looking for support in a way, and they're like, we're going to address this. We're not going to ignore it. We're not going to live with our little mummy tummy and have all these pains. Like, I feel like sometimes
Brazil, you can't believe the number of physical therapists and physicians I've trained in Brazil. They are, every day I get people contacting me from Brazil, physical therapists from Brazil.
Well, they have a super high C-section rate in that country. Yeah, so I could see 90%. Why. Yeah. I mean, there's a lot, every woman, almost every woman giving birth there is surgical. So they're going to need support.
Right. Because when they cut you there, and then they're cutting into the connective tissue to get to the uterus, it does weaken it. So it's really important, especially important to do my program and to do the scar mobilization.
Right. Because they have the C-section scar.
Yeah.
Awesome.
And if I'm wanting to reposition the connective tissue on the bottom and there's a scar there, it's sort of like if you think of a Ziploc bag where the zipper is, that's like, that's like a scar, what it does. It's like a Ziploc bag. So what we want to do is undo the Ziploc bag so then we can move the connective tissue closer together. Does that make sense?
Yeah, it's like it blocks the connection.
Yeah. It's like a stuckness. You can't move it if it's, if the layers of connective tissue are stuck together.
Right. And I think it's important to remember it's like multiple layers. Like it's not just a superficial layer that we can visibly see. It's all the way deep to the uterus.
and that's why they have that little muffin top. Looks like a little muffin because that's from the C-section scar. And you can get rid of that. You don't have to have that.
Right. You don't have to live with that.
You don't have to live with that.
Yeah, I think I'm really just hopeful that everyone listening to this episode today is just recognizing that if you're not happy with how your tummy looks, your wall, your abdominal wall and all of that, that you don't have to, it doesn't have to be just like, well, I'm a mom, so I've sacrificed.
This is my badge of honor for having children.
Right.
No. You don't have to live with this. This is fixable.
This is fixable.
If you do the program on your own, please make sure that you take their before belly pictures from the front and from the side, because then that will motivate you to continue the program. When you start seeing the changes, you'll go, oh my God.
Yeah, it's really important to remember what you looked like and the transformation that you're creating. And, I also know you mentioned that in your book, you talk about the nutritional component that helps with healing connective tissue. It's a whole lifestyle. It's not just the exercises.
Absolutely. And then in week 4, so we and I have developed a cream, a corrective connective tissue cream, and all the ingredients, are ingredients that, there's certain nutrients that are important for healing connective tissue. So they can download that. I have a sheet that has the nutrients for healing connective tissue, the function of the nutrients, the foods with those nutrients, and then in my cream, the ingredients that have those nutrients. So that there's a PDF that you can download and also an article on nutrition and diastasis. So, and then in week 4, so for the cream, it's to help nourish the connective tissue and also prepare the skin for taping in week 4 of the program. And I usually start that with people that have very severe diastasis. And that works similarly like a butterfly Band-Aid, where you stretch the tape and you put it on the skin, and then the tape wants to recoil to its unstretched position. And that process of recoiling is a communication from the skin to the connective tissue of the muscle. We're moving closer together. Just like when you do a butterfly Band-Aid for like a cut to bring the two halves together.
Right. Yeah, it makes perfect sense. Very cool. Well, Julie, do you have any last thoughts you want to share with the audience today?
Do I have any last thoughts? They can go to my website and also check to see if they have a diastasis. But if you've had a baby, or if you've been doing crunches or done gymnastics, more than likely you have it. And and if you're having the bloating after eating or the back pain or anything, then you just have it. You can check yourself. I have a little video. I have a lot of videos on my website under resources and Tupler videos. But my website is massive, and there's a lot of information. There's the Tupler tips that you can download. That's under resources, and then there's a video for checking your belly. So there's a lot of more wonderful information on my website.
And which website are you referring to?
Well, I only have one, the Diastasis Rehab. But if you type in Di Rehab or you type in Julie,
it will go to that page.
It'll go to that page, yes.
Got it. All right, that's wonderful that there's all these free resources for people to start their journey, get more information. I think this is also just really about connecting with your body, having self-love.
And connecting the connective tissue.
Connecting the connective tissue, because this is really what literally holds us together.
Right, exactly.
Oh my gosh. Well, Julie, I'm so grateful for you to take time to come on, share your passion and wisdom for this topic. And I just want more of my listeners to be aware that there is hope. There's a lot you can do to heal your body.
Well, thank you so much, because as you can see, I'm like a salmon swimming upstream here, trying to bring about awareness of this condition. So again, that medical and fitness professionals will check people for it. That is my goal, that it becomes mainstream.
Yeah, everyone should be checked. I agree. Well, thank you again, Julie, for coming on.
My pleasure, Laura.